Hi everyone, welcome to a new module on pneumonia. It is one of the most important topic in our basic, our preclinicals, our clinicals, our wards and whatnot. Before going into the crux of this disease, let us learn a quote. Your final goal may be perfection, but your next goal should always be progression. With this, we dive into the depth of the topic pneumonia. So, what you guys understand by the meaning pneumonia? I'm sure every one of you know what is pneumonia. You can express in your own terms what is pneumonia, but most of us don't know what the disease actually is. So, let us learn new concepts and clear our old concepts about the disease pneumonia. So, what is pneumonia? Pneumonia. The definition of pneumonia reads as it is an acute respiratory illness characterized by inflammation of the respiratory parenchyma leading to the solidification or consolidation of alveoli by inflammatory exudates. So here we come across a important term, the respiratory parenchyma. So what is respiratory parenchyma? We all have read from our anatomy classes of pulmonary or the respiratory system that the main bronchus divides into the right and the left bronchus. The individual bronchi then continues as the terminal bronchi, the respiratory bronchi, the alveolar duct, and the alveoli. So we we come to know that the respiratory parenchyma is a group of anatomical parts of the respiratory system, that is the respiratory bronchiole, the alveolar duct, the alveoli, the alveolar interstitium and vascular interstitium. So pneumonia is basically the inflammation of the respiratory parenchyma leading to solidification, or in medical terms we say consolidation of alveoli by inflammatory exudates. Now let us move forward into the pathogenesis of the disease. To learn the pathogenesis of the disease, first we should know about the history of the disease. Previously, in the past, lung was considered a sterile environment. People, the medicine personnel used to think that there was no any microbiota or microorganisms present in the lungs. So, with this concept, we further increase our knowledge on pathogenesis without diving into the new knowledge. So, lung was considered a sterile environment. So, as the environment was sterile, something needs to be inhaled or aspirate to get infected. So, there was inhalation. If there was inhalation or micro aspiration of organisms, there will be a breach of the alveoli. Normally in a normal lung, there is no micro aspiration due to pulmonary alveolar macrophages, gag reflex, mucociliary clearance. But due to any condition, if any of these are disrupted, then we get the micro aspiration of organisms leading to breach of alveoli. So whenever there is breach of alveoli, there will be a release of various inflammatory mediators from our immune system. So whenever the alveoli is breached, there is release of interleukin 1, interleukin 6 and tumor necrotic factor along with interleukin 8. Interleukin 1, interleukin 6 and the tumor necrotic factor are responsible for the fever which we get in pneumonia. But the interleukin 8 is an important part of the disease pathogenesis. Interleukin 8 leads to leukocyte infiltration, which is responsible for alveolar capillary leakage. So, with the release of interleukin 8, there is infiltration or induction of leukocytes. Thus, leukocyte infiltration will lead to leakage of the alveoli and its capillary. So, there will be exudation of fluid into the alveoli. This fluid will lead to a alteration in the ventilation perfusion ratio, which will manifest which will lead to hypoxia and manifest as dyspnea and cough. Okay, so this was the pathophysiology understood in the past. More of it remains the same, except we have known in the recent time that lung is not a sterile tissue. So previously it was considered a sterile tissue, but now, according to various researches, lung is not a sterile tissue anymore. So there is a lung microbiota. The lung has a microbiota, or the cluster of microorganisms. Any disruption of the cell mediated immunity, that is, we have already learned that cell mediated immunity, pulmonary alveolar macrophages is one of the important part of the cell mediated immunity. Any disruption of this pulmonary alveolar macrophages leads to increased activity of the microorganisms. Increased activity of the microorganisms which are already present in the lung microbiota. This increased activity of the microorganisms will lead to epithelial or endothelial injury of the lung, which will lead to the same release of cytokines, interleukins and other catecholamines. A new concept has been put forward that release of these catecholamines not only leads to leukocyte infiltration but also promotes growth of bacteria by acting as a nutrition. So again there will be excessive growth of the bacteria, which will lead to the same pathophysiology as we studied before, that is infiltration of infiltration of various interleukins and tumor necrotic factor, which will cause fever, cough, dyspnea and the classical symptoms of the pneumonia. As we have studied, pneumonia is inflammation of the lung parenchyma or respiratory parenchyma. But what if there is active tissue destruction and necrosis? We call it a necrotizing pneumonia or destructive pneumonia. Now we jump into the classification of pneumonia. So pneumonia is classified on the basis of various headings. So the first classification is based on the anatomy, that is the anatomical classification. The second is based on the setting. Okay, so we learn about the anatomical classification of pneumonia. Pneumonia is classified anatomically into lobar pneumonia, bronchopneumonia and interstitial pneumonia. Lobar pneumonia. So what is lobar pneumonia? Lobar pneumonia is inflammation and exudation of alveoli. Then what is bronchopneumonia? Bronchopneumonia is inflammation and exudation of the airways. What is interstitial pneumonia? Interstitial pneumonia is inflammation limited to interalveolar septa. Alright. Pneumonia, according to the setting, the environment, is classified into community acquired pneumonia, hospital acquired pneumonia and pneumonia in immunocompromised host. Alright. In this module, we'll be basically focusing on community acquired pneumonia. We'll focus on hospital acquired pneumonia and pneumonia in immunocompromised host in our further modules. So let us dive into community acquired pneumonia, which is very important topic to be discussed in our clinics. What is community acquired pneumonia? Community acquired pneumonia is defined as acute pulmonary infection in a patient who is not hospitalized or living in a long-term care facility. So anyone who is not hospitalized or not under some hospital care gets pneumonia, then we term it as community acquired pneumonia. So what is the etiology or the causative factors for community acquired pneumonia. The most common causative factor for community acquired pneumonia is our good old Streptococcus pneumoniae. Other organisms which are common causing community acquired pneumonia are Staph aureus, Haemophilus influenzae, Moraxella catarrhalis, and Legionella. Other less common organisms are Coxiella, Pseudomonas, and our viruses. That is respiratory syncytial virus, H1N1 influenza virus, and our not so favorite coronavirus. So here from this slide, it is important that we know about the most common cause of community acquired pneumonia, that is Streptococcus pneumoniae. But we must also know that there are other causes of pneumonia which are bacterial and viral. Now let us move to some important MCQ points which we can get in our internal external exams or any MCQ exams. So pneumonia in various associated conditions like alcoholism, in a person living in a hotel, in a person exposed to birds, sheep, goats, and in a smoking individual are caused due to various organisms. So first, alcohol. Pneumonia is in an alcoholic or in a person under alcohol influence is most commonly caused by Klebsiella. Likewise, Legionella is commonly isolated from a person getting pneumonia in a cruise ship or a hotel. A person infected, a person exposed to birds and sheep who get pneumonia, commonly Chlamydia psittaci and Coxiella burnetii are isolated from them respectively. Likewise, important for our entrance exam is COPD or smoking individual. Pseudomonas is a common isolated organism. This is the table from Harrison. So we will not go further deep into this table. If you are interested, then we can read this table. So moving forward, we have some factors predisposing to community acquired pneumonia. We already have studied the etiology, that is the microorganisms leading to pneumonia. Now we will deal with the factors predisposing to pneumonia, community acquired pneumonia. So the common factors predisposing to community acquired pneumonia are upper respiratory tract infection, cigarette smoking, alcohol, the extremities of age, that is the old age and the neonates or children, any pre-existing lung disease which may be COPD or bronchiectasis, indoor and outdoor pollution, and some of the immunocompromised states, that is glucocorticoid therapy, HIV, and malignancy can predispose to community acquired pneumonia. Now let us look into the presentation of pneumonia, how a patient presents with pneumonia in our hospitals, that is our outpatient department and sometimes inpatient department. Pneumonia has typical presentation and atypical presentation. Typically, we all know, we all have seen a patient in our wards or at least in our surrounding presenting with pneumonia. So typically there will be acute onset of fever, rigor, chills, and malaise. Appetite is lost. There will also be a cough. The cough is typically dry, short, and painful in the initial stage, but later it becomes mucopurulent with sputum. There may also be occasional hemoptysis. Pleuritic chest pain is a common symptom which is typically referred to shoulder or anterior abdominal wall. Now, pneumonia can also present as atypically. So it is very difficult to suspect pneumonia in such patients. It presents as gradual and insidious onset with low grade fever and dry cough throughout. These atypical presentations are difficult to diagnose and may be caused by certain organisms like Mycoplasma, Legionella, and Chlamydia. We must remember that Legionella is a organism causing both typical and atypical presentation of pneumonia. Likewise, typical presentation of pneumonia is caused by the common organisms, that is strep pneumoniae, the Staph aureus, Klebsiella, Moraxella, and Haemophilus influenza.